Good morning. Welcome for news for hearing impaired. I am Anil Thomas. With me, Manisha, this morning. First up, the headlines. Super cyclonic storm Amphan expected to cross the coast of West Bengal and Bangladesh between Digha and Hatia Island by Wednesday evening as an extremely severe cyclonic storm. Prime Minister Modi reviews preparedness, directs officials to take all necessary measures for complete evacuation of people from the affected areas and maintain essential supplies. Cabinet Secretary chairs National Crisis Management Committee meeting to discuss preparedness and requirements with concerned states. A total of 41 NDRF teams pressed into service to deal with the situation in wake of Cyclone Amphan. Indian Air Force on standby in case of requirement. Areas of West Bengal and Odisha likely to experience heavy to very heavy rains in the next 24 hours. Indian Railways take over 18.5 lakh migrant workers to their hometown through over 1,400 Shramik special trains. Stranded Indians continue to be brought back from other countries under the second phase of Operation Vande Bharat. A number of activities permitted to be started in the national capital Delhi from today. Markets can open on odd and even basis, while taxis and cabs will be allowed to ply with safeguards. All industries, essentials, standalone and neighborhood shops can open. Uttar Pradesh extends lockdown till 31st of May. In India, COVID-19 recovery rate improves to 38.29% with 36,823 people cured. Number of active cases increases to 56,316. 3,029 people have succumbed to the virus. Confirmed cases per lakh population in the country stands at 7.1 in contrast to 60 for the rest of the world. Global tally of confirmed COVID-19 cases nears 48 lakh with over 3 lakh 18,000 deaths. United States worst hit with over 91,000 deaths, followed by Italy, Spain and France. In some other news, gunfight breaks out between terrorists and security forces in Nawakadal area of Srinagar district in the wee hours today. 1 to 2 terrorists believed to be trapped. Mobile internet services snapped in Srinagar. More details awaited. And now for the stories in detail. Cyclone Amphan has intensified into a super cyclonic storm and is likely to move across northeast Bay of Bengal and cross West Bengal and Bangladesh coast between Digha and the Hatia Island on the 20th of May. The IMD has issued heavy rainfall warnings for several districts across West Bengal and Odisha till the 21st of May. The super cyclonic storm moved nearly northwards with a speed of 14 kilometers per hour and lay centered over west central Bay of Bengal, about 570 kilometers nearly south of Paradeep at 2:30 in the morning. Fishermen have been directed to not venture into the sea or be anywhere near the coast till May 21st. There is expected to be diversion or suspension of rail and road traffic. People in affected areas are advised to remain indoors. Movement in motorboats and small ships is not advisable. In view of the cyclonic storm, Odisha government has put 12 districts on alert. Arrangements are in place to evacuate 11 lakh people. Director General of the National Disaster Response Force, S.N. Pradhan, stated that 10 NDRF teams have been deployed in various districts of Odisha. 10 additional teams have also been put on standby. Odisha Special Relief Commissioner has written to collectors of Balasore, Bhadrak, Kendrapada, Jagatsinghpur, Puri, Khorda, Cuttack, Jaipur and Mayurbhanj on evacuation of people to safe shelters while taking care against the spread of COVID-19. In West Bengal, the north and south 24 Parganas, east and west Mednipur, Howrah, Hooghly and several other districts are likely to experience light to medium rainfall today due to the cyclonic storm. Some far-off districts are also likely to experience heavy rainfall. The administration has made all arrangements to deal with any emergency. Special control rooms have been established. State disaster response teams have also been deployed. NDRF teams were also spreading awareness amongst the people. Last time a super cyclone hit India was way back in October 29, 1999 in Odisha. Prime Minister Narendra Modi reviewed the preparedness of states and central ministries and agencies concerned to deal with the situation arising out of the super cyclonic storm Amphan. Prime Minister had directed that all necessary measures be taken to complete the evacuation of people from areas in cyclone path and maintain adequate quantities of essential supplies. All concerned have been advised to make the adequate preparations to ensure maintenance of essential services such as power, telecommunications in the event of damages caused to them, and also to review the preparedness well in time and ensure quick resumption of services in the event of any disruption. Home Minister Amit Shah was present along with senior officers of Government of India and officers of IMD, NDMA and NDRF. Meanwhile, the National Crisis Management Committee under the chairmanship of Cabinet Secretary Rajiv Gauba met for the second time to review the preparedness of states and central ministers and agencies to deal with the super cyclone. Reviewing the preparedness of the states and central agencies, Cabinet Secretary directed that all necessary measures be taken to complete the evacuation of people from low-lying areas in cyclone path and maintain adequate quantities of essential supplies such as food, drinking water and medicines, etc. Agencies were directed to prevent disruptions to power and telecommunication services. Free facility of targeted SMS to warn the people of the cyclone and intra-circle roaming is to be provided. Chief Secretary Odisha and Principal Secretary West Bengal participated in the meeting through video conference. Senior officers from the Ministries of Home Ministry, Defence, Shipping, Power, Telecommunications, Health, IMD, NDMA and NDRF also attended the meeting. NCMC will meet again today to take stock of the emerging situation. Director General of the Indian Meteorological Department, Mrityunjay Mahapatra, said that the cyclone is having the potential to cause intensive damage. He said that most damage will be caused at the place of landfall.
बहुत ही इंटेंस साइक्लोन है। इसका एक्सटेंसिव डैमेज या लार्ज स्केल डैमेज करने का पोटेंशियल है और सबसे ज़्यादा इम्पैक्ट वहाँ होता है जहाँ वो तट को पार करता है। इसलिए सबसे ज़्यादा इम्पैक्ट इसका वेस्ट बंगाल का जो साउथ एंड नॉर्थ 24 परगना है और ईस्ट मिदनापुर डिस्ट्रिक्ट है वहाँ ज़्यादा होने का उम्मीद किया जा रहा है।
Director General of NDRF S.N. Pradhan said that 19 teams of NDRF are deployed in West Bengal and 4 teams are in standby.
पश्चिम बंगाल में कुल 19 टीमें तैनात की जा रही हैं और 4 टीमें स्टैंड बाय में रखी जा रही हैं, 19 और 4 पश्चिम बंगाल में। इसी तरह उड़ीसा में 13 टीमें तैनात की जा रही हैं और 17 को स्टैंड बाय में रखा जा रहा है और एनडीआरएफ की टीमें अपनी अपनी जगह पकड़ चुकी हैं और कुछ टीमें जो ट्रांजिट में हैं अपना जगह पकड़ लेंगी। जो टीमें अपनी जगह पर पहुंच चुकी हैं वो अवेयरनेस ड्राइव और सेंसिटाइजेशन का काम तथा इवैक्यूएशन में मदद कर रही हैं।
Active cases of COVID-19 in the country stands at 56,316 with 3,029 fatalities so far. 36,823 people have been cured or recovered from the pandemic. Maharashtra remains the worst hit state with more than 33,000 confirmed cases. Delhi, Tamil Nadu and Gujarat have reported more than 10,000 active cases. The fatalities stand at 3,029. Union Health Minister Dr. Harshvardhan participated in the 73rd World Health Assembly through video conferencing. Health Minister said that India is playing a key role in fostering bilateral and regional partnership to fight COVID-19. Health Ministry yesterday issued
in fostering bilateral and regional partnerships. Under our Prime Minister's able leadership, India has supplied essential medicines to 123 nations as an expression of solidarity. Therapeutics, diagnostics and vaccines for the whole world is the only way out of the pandemic. Global collaboration is paramount. Governments, industry and philanthropy must pool resources to pay for the risk, the research, manufacturing and distribution, but with the condition that the rewards should be available to everyone.
Health Ministry yesterday issued guidelines on the preventive and response measures to contain the spread of COVID-19 in workplace settings. According to the latest guidelines, any staff reportedly suffering from a flu-like illness should not attend office and seek medical advice from the local health authorities. Such persons, if diagnosed as a suspect or a confirmed case of COVID-19, should immediately inform the office authorities. Any staff requesting home quarantine based on the containment zone activities in the residential areas should be permitted to work from home. The guidelines also stated that DOPT guidelines with respect to organizing meetings, coordinating visitors shall be followed. Health Ministry, however, stated that despite taking the measures, occurrence of COVID-19 infection among the employees working in the office cannot be ruled out. When one or a few persons who share a room or close office space are found to be suffering from symptoms suggestive of COVID-19, the ill person should be placed in an isolated room or area. Central or state health authorities concerned should be reported about such cases and a risk assessment will be undertaken by the designated public health authority. If a suspected case reports very mild or mild symptoms on an assessment by the health authorities, the person would be placed in home isolation subject to fulfillment of criteria laid down by the Health Ministry guidelines. The necessary action for contact tracing and disinfecting of workplace will start once the report of the patient is received as positive. Stranded Indians continue to fly back to the comfort of their homeland through the Vande Bharat mission. The latest special flight to arrive with Indians was from Doha to Kozhikode. Special flight IX-374 was carrying around 180 passengers from Doha and it landed at Kozhikode. Special flight IX-0452 from Abu Dhabi also brought back 173 passengers and 2 infants to Kochi. The passengers included 21 persons with medical emergencies, 41 pregnant women, 79 people who had lost their jobs and 19 stranded tourists. This is the 4th flight to Cochin during the 2nd phase of Vande Bharat mission. 2 passengers who showed COVID-19 symptoms were moved to the COVID hospitals. A flight carrying 41 passengers from UK landed at Gaya airport in Bihar on Monday afternoon. This is the first flight under Vande Bharat mission to Bihar. The flight had 31 passengers belonging to Bihar and 10 to Jharkhand. All the passengers will be kept in paid quarantine at the pre-purposed hotels and guest houses at Gaya. They will be released for their respective destinations after a quarantine period of 2 weeks. 5 more flights are scheduled for Bihar under the Vande Bharat mission. These flights are scheduled to come to Bihar on the 24th, 25th, 26th of May and on the 1st and 3rd of June. Earlier, a total of 169 Indians were evacuated by Air India flight to Kolkata. The passengers on this flight included 73 students, 16 elderly people, 45 stranded tourists, 16 cases of medical emergency and 1 pregnant lady. Not only in Dhaka, but people stranded across Bangladesh were identified and the passengers have come from 18 different districts. In West Bengal, after completion of quarantine, they will travel to their homes spread across more than 20 districts. Six special flights from the Gulf countries of Saudi Arabia, UAE, Kuwait, Bahrain and Qatar will take back more than 1,000 distressed Indians back to their country today. There are 2 flights from Saudi Arabia. There is a flight from Riyadh to Kozhikode and the other from Dammam to Kochi, which will carry around 150 passengers each on the flight. The Dubai-Delhi flight is expected to take back around 179 people, while the flight from Kuwait and Doha will take back around 350 people to Kannur. The flight from Bahrain is expected to take back around 179 people to Hyderabad. Priority is being given to the distressed blue-collared workers, medical emergency cases, pregnant women, stranded tourists and elderly people to go back on these special flights. More than 40 flights from the Gulf countries are being operated during the phase 2 of Vande Bharat mission. Back home, gunfight broke out between militants and security forces in Nawakadal area of Srinagar district today. A joint team of police and CRPF launched a cordon and search operation in Nawakadal. As a joint operation between the teams approached towards the suspected spot, the hiding militants fired upon the team, triggering an encounter. As per the sources, 1 or 2 militants are believed to be trapped. Mobile internet services have been snapped in Srinagar in wake of the encounter. Looking at the global numbers, global tally of confirmed COVID-19 cases is nearing 48 lakh with over 3 lakh 18,000 deaths reported. United States remain the worst hit with 91,000 deaths. US President Donald Trump has once again attacked the World Health Organization, saying that it has done a very sad job in its handling of COVID-19. He also said that he would issue a statement about WHO in the near future while considering slashing or cancelling US support. USA is the largest contributor to the WHO. Meanwhile, Trump has said he is taking a malaria drug to lessen symptoms should he get the new COVID-19, even though the drug is unproven for fighting COVID-19. He added that he has been taking the drug hydroxychloroquine and a zinc supplement daily for about a week and a half now. He asserted that he has been having 0 symptoms from it. Earlier in the day, Trump participated in a roundtable with restaurant executive and industry leaders as part of the country begin to reopen amid the coronavirus pandemic. Meanwhile, New Jersey, hardest hit by the COVID-19 after its neighbor New York, has allowed non-essential retail businesses and non-essential construction to resume operations beginning on Monday. A region in the western corner of New York that includes Niagara Falls will become the 6th region in the state to start reopening from today after clearing a final hurdle related to contact tracing for COVID-19. 5 regions across a large swath of central and upstate New York were given the green light to start the first phase of reopening on Friday after meeting 7 criteria focused on keeping hospitalizations and infections at a manageable rate. New York has accounted for 1/3 of the nearly 90,000 Americans who have died from COVID-19. Over 15,06,000 people are confirmed to be infected, while over 2,83,000 people have recovered. WHO, that's the World Health Organization chief, has said that an independent evaluation of the global COVID-19 response would be launched as soon as possible, and China backed such a review. Director General Tedros made his promise during a virtual meeting of the WHO's decision-making body, the World Health Assembly, at which Chinese President Xi Jinping defended his country's own handling of the crisis. US President Donald Trump has fiercely questioned the WHO's performance during the pandemic and led international criticism of China's handling of the early stages of the crisis. Tedros, who has always promised a post-pandemic review, said it would come at the earliest appropriate moment and provide recommendations for future preparedness. Nepal reported 80 new cases of COVID-19 on Monday, taking the total number to 375. According to the Ministry of Health and Population, 18 persons diagnosed with COVID-19 yesterday night. Earlier in the day, 62 persons were tested positive. The condition of all new patients is reported to be normal. There are 337 active cases in Nepal, while 36 patients have recovered. 2 persons have lost their lives due to COVID-19 so far. Currently, 20,090 people are under quarantine and 412 persons have been kept in isolation across the country. Britain's lauded the ease of drive-through appointments at testing units as the government expanded its testing scheme to allow anyone aged over 5 with COVID-19 symptoms to book a test to see if they have the virus. Londoners arrived at a test facility said the process from booking a test to receiving one was quick and efficient. Britain's coronavirus test and trace app continues to be trialled on the Isle of Wight, seen as the key to easing restrictions on the movement that has paralyzed economies. An expanded testing program and track and trace system are key parts of Britain's plan to move back to normality after a viral outbreak. Meanwhile, the death toll in United Kingdom reached 34,796 on Monday. Normality is tiptoeing back in Italy as the country speeds up efforts to bounce back from the COVID-19 crisis after a 10-week lockdown. The stunning lagoon city of Venice also opened for business on Monday but saw no tourists, while shop owners saw slowly reopening of their businesses as residents re-enjoyed the pleasure of sipping an open-air cappuccino sitting on tables at least 2 meters apart. About 32,000 Italians have died of COVID-19 since the outbreak came to light on February 21st, the 3rd highest death toll in the country after United States and Britain. Over 2,25,000 people are infected, while 1,27,000 people have recovered in the European country. Moving to neighbor Spain, restaurants and cafes on Valencia's seafront set up their terraces to reopen their businesses on Monday. On Friday, Spain's health ministry had announced that the Valencia region would progress to phase 1 of the government's 4-phase de-escalation plan to exit one of the strictest lockdowns in Europe. In this phase, bars, restaurants and places of worship are able to reopen at limited capacity. Waiters measure the distance between tables in order to maintain social distancing rules. Also, museums in the city opened for the first time on Monday on International Museum Day as the region entered in phase 1 of the de-escalation plan over the COVID-19 emergency. As under this phase, with limited restrictions, museums can reopen with strictly limited capacity, although in Madrid, major museums like the Prado Museum and the Reina Sofia Museum will not reopen until June. However, 4 of Spain's small islands entered phase 2 on Monday ahead of the rest of the country, which is either in phase O or 1. Under phase 2, residents can enjoy greater freedom of movement. Restaurants can open their interior to 30% capacity, as can hotel common areas. The small islands are heavily dependent on tourists, which account for over 12% of Spain's economic output. Spain's overnight death toll from the COVID-19 was 59 on Monday, the lowest figure in 2 months. The country's death toll has now reached 27,709, with 231,000 cases being reported infected. Well, that's all we have time for in this edition of news. Thanks for watching, but stay safe, stay indoors and be positive. Bye.